Now we're going to talk about diseases of the thyroid gland. And they are iodine deficiency, which is rare in balanced diets, overproduction of T3 and T4 by the thyroid gland, which is common, and underproduction of T3 and T4 by the thyroid gland, which is even more common. There can be overproduction or underproduction of thyroid stimulating hormone by the anterior pituitary, and this is very rare. There can also be autoimmune disorders, which can be common, and tumors of the thyroid gland, which are also common. Next, we're going to talk about the term goiter. Goiter refers to an enlarged thyroid gland. And here we see pictures of an enlarged thyroid. On the left, you see a normal-sized thyroid, and on the right, the thyroid gland is enlarged. And this is called a goiter. Here we see a very extreme case of a goiter in which the tissue actually extends down into this patient's thorax, and you can see the goiter there extending down into the thorax. So although a goiter is used to describe lumps on the thyroid, which is also referred to as nodular goiter, the term goiter should really be reserved for enlargement of the entire thyroid, which is diffuse goiter. Goiter can be associated with hyperthyroidism, high T3 and T4 levels, and this is Graves' disease. A goiter can also be associated with a low T3 and T4 level, and this is referred to as hypothyroidism, and this can occur due to iodine deficiency. Sometimes goiters can be associated with euthyroid states, which are normal states, and the goiter only means that the thyroid is enlarged. Goiter can also be associated with dietary intake, and some foods called goitrogens can actually cause the thyroid to grow. And these are some examples of some goitrogens. Here are some more. Goiter can be associated with acute temporary conditions, such as a viral infection. And goiter can be associated with hypothyroidism, low T3 and T4, like in the case of iodine deficiency. Iodine deficiency is rare because of the presence of iodine in our diet. That's why iodine is put into table salt. Iodine deficiency causes diffuse hypothyroid goiter. But why? Iodine deficiency decreases T3 and T4 synthesis because iodine is required for T3 and T4 synthesis. T3, remember, is called triiodothyronine. So when T3 and T4 blood levels decrease, the anterior pituitary increases the release of thyroid stimulating hormone. Then what happens when TSH goes up in iodine deficiency? The thyroid is stimulated to grow, but there is still no iodine to make the thyroid hormones. But the thyroid can't release T3 and T4 because it needs the iodine for the synthesis of these hormones. So the thyroid just continues to grow and grow and grow. So if you give these patients iodine, the problem is corrected. Iodine deficiency is rare because of diet, so this example was used to describe a diffuse goiter. Next, we're going to talk about hypothyroidism.